Research continues to show that chronic inflammation is a root cause of heart disease, diabetes, cancer, autoimmune disorders, polycystic ovarian syndrome, gastrointestinal diseases like Crohn's, ulcerative colitis, celiac disease, and many kinds of musculoskeletal problems where pain is involved. And to go one step further, if you can lower this inflammation, you'll be one step closer to feeling better, but also getting your health problem under control. Hi there, I'm Dr. Hagmeyer, and today I'm talking about chronic inflammation, but specifically I want to talk about some of the most important tests that can help identify inflammation in your body. If you suffer with chronic health problems like the ones that I mentioned, and you don't feel your current doctor is taking your health seriously, or they won't run these tests, I'll leave a link in the description box where you can get these tests done at a fraction of the cost you would if you were to go to your doctor. Let's first quickly go through what you should get tested when it comes to inflammation. Number one is I've already named a few of the conditions at the beginning of this video, but I would add that the following symptoms are also important to consider. If you're someone who has trouble losing weight, if you're tired and run down and fatigued all the time, if your joints feel achy and swollen and are constantly in pain, you have skin problems, whether it's acne, psoriasis, or hives, you've been diagnosed with heart disease, thyroid problems, depression, you are experiencing brain fog or other kinds of mental health problems. If you're a man with erectile dysfunction, low libido, if you have any of these symptoms or any of these diseases, running these tests could be a complete and total life changer for you. Now, I know that's a long list, but I test almost every single patient that I work with for many of these markers and a few others as part of every new patient initial blood workup. In root cause medicine and functional medicine, we want to know if someone's inflamed, and if so, how severe is the inflammation. Now, the tests that I'm talking about today should be performed routinely to not only detect the degree of inflammation that you have, but also to monitor the degree of inflammation to determine if what we're doing as far as treatment goes is working, and if so, how much improvement are we seeing? In other words, if your treatment is working and the body is moving towards a healthier state and inflammation is decreasing, that's something that we obviously want to know about. We want to see that improvement. And again, these tests are not a one and done kind of test. If these tests do show improvement, you keep doing what you're doing until they actually stop improving or your markers now normalized. Now here's the thing, you should get any abnormal marker retested within 60 to 90 days, sometimes 120 days, and then monitor them on a yearly basis just to catch signs of early inflammation. So test number one, C-reactive protein. The C-reactive protein test is a blood test. It's a marker that's used to assess levels of inflammation in the body. CRP is a protein that's produced in the liver. It's also known as an acute phase reactant, which means that it goes up and it goes down based on the degree of inflammation or trauma or infection that's in your body. Now, there are two different kinds of CRP tests. The one that I recommend for patients is the HS CRP test, and HS stands for high sensitivity. Again, this has also been used for cardiovascular risk assessment. It's because, again, CRP levels has been linked to heart disease. It's been linked to stroke, pulmonary embolism. CRP is also useful in diagnosing and monitoring chronic inflammatory conditions. In other words, things like inflammatory bowel disease, arthritis, autoimmune diseases, and then mental health issues. If you've had this test done, you may be wondering, what's a good level for this to be at, right? Well, here's the thing. You want your levels as close to zero. The next test is the erythrocyte sedimentation rate, or ESR for short. Again, another great test that measures inflammation. When your body's inflamed, your red blood cells or your erythrocytes, they stick together or they clump together. And again, the erythrocyte sedimentation rate is a test that measures how fast these red blood cells sink to the bottom of a test tube over the course of an hour. The faster they sink, the more inflammation you have. Now, ESR can be elevated in patients, again, with autoimmune diseases. These are going to be things like rheumatoid arthritis, mixed connective tissue disorders, lupus, Hashimoto's disease, inflammatory bowel diseases like celiac, Crohn's, ulcerative colitis, just to name a few. Where again do we want to see ESR levels? Well, just like the CRP tests, optimal levels should be 0. The next inflammatory test I want you to know about are your serum ferritin levels. Ferritin is a great test because on one hand, it provides information regarding your iron levels. But on the other hand, if it's too high, it's a marker of inflammation, tissue damage, and oxidative stress. Ferritin is actually a storage protein for iron. Iron floats around your blood, but it's stored in the liver. So if you think about ferritin, it's like a bank account of iron. So low levels of ferritin typically indicate that there's been blood loss or anemia, whereas high levels of ferritin indicate tissue damage, oxidative stress, and inflammation. Sometimes these levels can go too high, and if you're taking too much iron supplementation and you're not monitoring those levels, you can be causing problems rather than fixing them. Like the CRP test that I just mentioned at the beginning of this video, ferritin is an acute phase reactant. It goes up with inflammation, chronic infection, and liver disease, autoimmune disorders, and then it comes down as your health begins to improve. So people can have genetic problems with iron toxicity, and this is associated with very high levels of iron and ferritin in the blood, sometimes called hemochromatosis. Now, I like to see ferritin levels between 80 and 100, and if you have levels that are less than 40 and you also have a low red blood cell count, and the size and weight of your red blood cells are decreased. So again, your MCV and MCH, if you're looking at your blood work, if those are low, you probably would benefit from taking supplemental iron. But again, it's best to consult your doctor with how much iron you should be taking, because that's going to be based on how low your levels are. If you do start taking iron, don't go 4 or 5 months without getting it retested. I recommend that you get your levels rechecked within 60 to 90 days. Now, another great test for inflammation is homocysteine. Homocysteine is an amino acid. It's a building block protein. It's produced by the body, and it's used to make things like glutathione, which helps quell inflammation and protect your cells. Glutathione is also used to make something called SAMe. SAMe plays a role in methylation and the production of neurotransmitters and supporting phase 2 detoxification. Now, when homocysteine levels go too high, this indicates that there's damage to blood vessels. Blood vessels in your heart, blood vessels in your brain, blood vessels in your lungs. High levels of homocysteine make the blood clot, clump together, and again, this can increase the risk of blood vessel blockages. If this happens, we call this a clot or a thrombus. Now, this thrombus can travel through the bloodstream, and from there it can get stuck or lodged in your lungs, your brain, or your heart. In the lungs, we call it a pulmonary embolism, which is not good. In the brain, we call it a stroke, not good. And in the heart, we call it a heart attack. So again, these things are not good. People are so worried these days about high levels of cholesterol and high levels of LDL cholesterol. But let me tell you something. You need to be more worried about elevated CRP levels and elevated homocysteine levels. These tests are stronger predictors of heart attacks compared to total cholesterol and LDL levels. Now, there's many different causes of high homocysteine, and most often the cause has to do with a variety of genetic SNPs or polymorphisms. Many genes that regulate methylation can be distorted, and if your homocysteine levels are too high, you may not be getting enough B6, you may not be getting enough B12, or you could have a folate deficiency. Other possible causes of homocysteine levels that are elevated are going to be things like hypothyroidism, you have low thyroid hormones, kidney disease, psoriasis, pernicious anemia, or autoimmune diseases that affect the absorption of B12, like chronic gastritis or atrophic gastritis. There are certain medications that can do that, and of course, like I mentioned a moment ago, genetic SNPs. Now, the thing to be most aware of is that insulin is another inflammatory test that we like to look at, and this is your fasting insulin, very, very important. This is not a test that I run all the time unless I see a patient has many symptoms of blood sugar imbalance or hormonal imbalances. Insulin is a hormone that's produced and stored in the pancreas. Insulin helps take glucose from the blood and gets it into the cells, where then your body can utilize it for energy. Now, the problem with glucose is if it's too high, it's a problem, and if it's too low, it's a problem. Insulin has a very, very important job in regulating our blood sugar levels. And again, sugar needs to get into the cells to be converted into energy. And one of the biggest problems we see with blood sugar symptoms is fatigue. Again, different foods we eat can cause that. The other thing about this high insulin is that it can cause brain fog, it can cause waking, it can cause hormonal problems, it can cause things like depression. High insulin affects your liver, your thyroid, your heart, your hormones, and your brain. Some people, again, have too much insulin, while others have too little insulin. Both are very serious problems that require attention. Optimal levels, I like to see fasting insulin, are less than 6, but no lower than 3. If your fasting insulin is lower than 6, I recommend, higher than 6, I recommend that you start a high protein, high fat diet, a low glycemic index fruits, and start considering taking supplements like berberine, zinc, fenugreek, alpha-lipoic acid, chromium. Again, I'll leave this information in the description box. Studies have shown that these medicinal herbs can be incredibly helpful in maintaining healthy blood sugar levels. In many studies, these herbs have been shown to actually be more effective than the diabetic drug metformin or glucophage because they come without all the nasty side effects. Now, some final thoughts and reminders. Inflammation is associated with most chronic health problems. Today, I talked about some of the most important tests that can help clue you into the degree of inflammation in your body and why it's important to monitor them. I talked about some of the very best screening tests for inflammation: CRP, ESR, homocysteine, fasting insulin, and ferritin. One thing to keep in mind is that these markers, if they're elevated, we still need to investigate where the inflammation is coming from. All right, well, there you go. I hope you found today's information helpful. Be sure to check out the links in the description box. If you want to get a hold of me or work with my clinic, I'll leave some information in that section as well. If you have questions about today's video, drop me a comment or a question in the section below. And again, that's just going to wrap up today's video. I'm Dr. Hagmeyer. Until we meet next time, take care.